There are 31 days in October, 31 days devoted to raising awareness about the impact of breast cancer.
Yeah, so to talk more about the importance of getting your mammogram, we're going to welcome in Dr. Deepa Halaharvi. She is a breast surgeon from Kansas City University. Welcome, doctor. So it's my understanding you're not only a surgeon, but you're also a breast cancer survivor. Can you tell us a little bit about your story?
Yes, I am a KCU graduate from medical school in 2008, and I did my general surgery residency and then a breast surgery fellowship here in Columbus, Ohio. And as soon as I finished my fellowship in 2014, 5 months or 8 months later, I was diagnosed with breast cancer on a screening mammogram. So this was after I was already working as a breast surgeon. And so, I mean, who is better to have breast cancer than a breast cancer surgeon? And that's what usually I tell people. So.
Yeah, and that's probably the reason why you went into your line of work, right? That's because you wanted to help other women.
Yes, absolutely. I love the relationships I develop with the women, and I love to get a woman from diagnosis to survivorship. A great deal of satisfaction for me helping those women.
What would you say is the important reason, to get a mammogram? What age should women start? Because you're a young doctor, so
Yes.
I'm assuming that you probably got
Thank
yours.
you for calling me young.
You are young, but you probably got yours at a younger age than maybe what most women would.
Yeah, so I was diagnosed actually at 41 on a screening mammogram, and women should start getting mammography at age 40 if you do not have family history of breast cancer. If you have family history of breast cancer, you should start 10 years earlier than the youngest family member who was diagnosed. And, the recommendations change from year to year. It's very confusing, but if one number you want to remember is starting mammograms at age 40.
Dr. Halaharvi, what would you say to someone who just found out that they have been diagnosed with breast cancer?
Yeah. So I see that every day this week. I probably had 10 patients who are diagnosed with breast cancer. There is always hope. And, regardless of diagnosis or prognosis, we come so far in our treatments, and we're so advanced in the management of how we manage breast cancer. It is not the most common cause of death. Heart disease is still the most common cause of death for women, because that's what women are worried about. Am I going to die of this cancer? And that's one good thing about getting mammograms early on. It does detect cancer when it's fairly small and treatable, which will require less invasive surgeries and less invasive treatments.
Okay, so I think what's really important to remember from all of this is the age is 40. If you are 40, nearing 40, that's when you need to go get that mammogram.
Yes, that is correct.
All right.
Dr. Halaharvi, thank you so much for joining us this morning. Really appreciate it.
Thank you so much. Thank you. I love you guys. I love Kansas City. That's my home. So.
Oh, awesome. Well, come back and visit us anytime. We'd love to hear your expertise some more, okay?
Sounds great.
All right,
sounds great.
good.
Thank you guys for having me.
Thank you.
Have a great day.